We're going to look into, or we're going to speak, more about this topic with our first guest, Dr. Tony. Dr. Tony who is a co-chair and retired consultant, pediatrician at Keep Our NHS Public, right? So, Dr. Tony, thank you for joining us in today's Drive Time show.
Thank you for having me with you.
Yes, so Dr. Tony, my first question to you is that from your clinical and campaigning experience, what do you see as the single biggest threat to the NHS at present?
Well, if I had to give one overriding risk, it's the political hostility from successive governments to investing in the public service that is the NHS that we all know we actually need. And coming from that political hostility, the desire to turn it away from a public service into privatised services, you've had two trends over many years, especially under the Conservatives, but continuing now really under the Labour government last year, to underfund the NHS so that it can't do its job properly, and to start investing more and more of funds that should go to the NHS to private contracts, to private companies.
Yeah, so Dr. Tony, we hear more about patients now turning to private healthcare. So in your point of view, what risk does this pose for the founding principle of the NHS?
It's a huge risk. The NHS, when it was funded fully so that it could succeed, and that was right up to the end of 2009, 2010, there was always a private health sector, but the vast majority of the population didn't use it. They didn't need to use it. So the principle of the NHS, which is that there's universal access, there's democratic access to healthcare for everybody on an equal footing, and that it's paid for as a kind of social contract that we all pay into the NHS through our taxes and in national insurance and so on. And if we're out of work, we don't have to do that. But when we're back in work, we do that. And when we all need the NHS from the cradle to the grave, it is available for us on an equal footing. And when patients are driven to try to avoid the huge waiting list, when they're driven to take choices to go privately, either they do that because they can afford it, which means that there's huge inequality. Those that can't afford it can't access it. Or they take out loans that they can't afford, and then they go into debt. And as time goes on, it will erode the idea that the NHS is there for all of us, and it's paid for fairly and democratically. And some people will say, why should I pay twice? Why should I pay the NHS when I'm also going privately? So those are some of the dangers that I would see. And they are manageable if we start to rebuild the NHS back to where it was when it was functioning, when waiting lists were no problem, when you were seen promptly in the emergency department and you were waiting for no longer than 18 weeks in order to not only be referred to hospital, but to have your treatment.
Dr. Tony, one thing that we mentioned, I think, why we have the NHS crisis is due to the lack of staff. And many staff, as a result, what happened, and then they will have to work longer shifts, right? And, then they describe it as burnouts, and then they also feel as if they are undervalued. So how do these, workforce challenges, affect patient care, and what solutions, what would you prioritize?
It's a real danger for patients because they are receiving care that is either delayed because they're on waiting lists, or if you're on a really busy ward or you're waiting in A&E and you're waiting hours for treatment, then the risks to you increase. And for every hour that goes on beyond 6, 8, 10, 12 hours waiting for treatment in A&E, the risks of you dying from it go up and up and up. So that one of the risks is 16,600 avoidable deaths due to delayed care in emergency department last year, and that is ongoing. There's also a risk to the staff themselves, where they know that they can't give as good care as they would want to, and they're trained to do, and they suffer. Well, one of the terms that's used is moral injury. They're in work, they have responsibility to patients, and they know they can't fulfill it to the best of their ability because there's not enough staff. And that's a failure of government to have a workforce plan that has trained enough staff and has put money into the budget in order to employ enough staff.
Yeah, so Dr. Tony, so, politicians, often promise reform of the NHS. So in your opinion, what does real reform actually look like, right? And what misconception about fixing the NHS concern you the most?
Yeah. Well, that's a good question. We frequently question what is meant by reform when it comes out of the mouths of politicians. And what it often means is that they want to change the NHS model into one where charges are brought in, where there's a partnership with the private sector more and more. And that's not reform, that's distortion of the NHS. So for me, the biggest single reform would be to have a public debate that says we need a publicly provided NHS. We know from evidence that it's the cheapest, it's the most cost-effective form, and it's the safest form. But we need a change of political attitude. So the reform I would advocate is a change of direction in our political parties. There are a couple of parties that are arguing along the lines of that, and they've more or less adopted our position that the NHS, when it works best, is funded to succeed, and it's delivered by publicly employed staff that have the interests of the patient and interests of the country at heart.
So, Dr. Tony, looking ahead, what message would you like to leave with our listeners about how ordinary people can help safeguard the NHS for future generations?
I would first appeal to everybody to continue to trust in the NHS. I think in your previous discussion, you were saying that there's a fall-off in satisfaction amongst the general public with the NHS. And of course there will be, because people are finding it hard to get an NHS GP appointment. They're finding it increasingly impossible to get an NHS dentist. And they're on long waiting lists of 7.5 million people. But people should know that when the Conservative government's period in office ended in 1997, the waiting times and the state of the NHS was also in deep crisis. And for 10 years up to 2009, the funding that went into the NHS rescued it. And the majority of that funding was actually in publicly provided services. And patient satisfaction was never higher during that period. By 2009-10, it was the highest it's ever been. Waiting times were not a problem, and patient satisfaction and indeed NHS staff satisfaction was really good. So the message is, we did it before, we can do it again. Please tell your MP, we don't want money to go into private profits. We want it to go into rebuilding the NHS. We want you to pay our NHS staff properly, to restore the value of their pay. Write to your local press, or indeed contact Keep Our NHS Public and work with us, please. That would be great.
Yeah, that's very beautifully said, Dr. Tony. And thank you very much for joining us, for today's Drive Time show and taking your precious time out. And hopefully we'll have you once again in our Drive Time.
Thank you very much indeed, and good luck.